The Centers for Disease Control and Prevention, CDC, documented the first cases of AIDS in 1981. Within that month, 26 cases were identified, one of which was a Black individual. A concerning trend then emerged. In 1982, 20% of all cases that year were among Black individuals. And by 1984, 50% of pediatric AIDS cases were impacting Black children. In 1986, a report highlighted that Black individuals accounted for 51% of all AIDS cases among women, with an overall AIDS rate 3 times higher than that of their white counterparts. A 2021 CDC report on new HIV infections among racial and ethnic groups in the U.S. shows that this troubling trend has continued. An estimated 487,500 Black individuals are living with HIV, a rate that is 7 times higher than among white individuals. Black individuals, who account for approximately 13.7% of the population, account for 40% of new HIV infections. 2020 research also showed that Black individuals diagnosed with AIDS die at a rate that is 7 times higher than their white counterparts. Use of preventative medication like PrEP also varies significantly by race and ethnicity. The lowest uptake is seen among Black individuals, despite their higher rates of HIV prevalence. Geography also plays a role, with the HIV epidemic hitting the southern U.S. the hardest. Approximately 46% of people living with HIV reside in the South, and Black individuals account for 54% of new HIV diagnoses in that region. Black women are still heavily impacted by HIV. They are 10 times more likely to be diagnosed with HIV than their white counterparts. Factors that may cause these differences include economic stability, access to good education, access to health care, the environment of the neighborhood, and social influences in the community. Addressing these disparities for Black individuals living with HIV requires a holistic approach that includes prevention, testing, treatment, and support services. This may include providing vocational and life skills training to support self-sustainability, ensuring stricter adherence to anti-discrimination laws in educational settings, expanding Medicaid in the states that haven't yet fully adopted it, forging partnerships and information sharing to deliver housing and support services, and increasing engagement through peer support groups and social media campaigns to destigmatize HIV.